The last few years have been like none before. We face almost impossible odds, from old public health enemies making a comeback to new public health threats emerging. Polio in South Asia, HIV in Sub-Saharan Africa, Ebola in West Africa, MERS-CoV in the Middle East, Zika in South America. All these threats, underpinned by a globalized society that is more at risk than ever before due to increasing travel and connectedness, environmental challenges, and changing lifestyles more susceptible to chronic diseases. To our collective dismay, the governance, the collaborations, the informatics, and the analytics to respond to these threats have been outpaced. Now, more than ever, public health surveillance must be transformed to provide protection to our society. In the new text, Transforming Public Health Surveillance, we share a vision of how public health surveillance can be transformed by inter- and interagency collaboration, by new analytics, by public health informatics, and by the collective vision of achieving a public health surveillance state where data can be accessible and interpretable that can change the face of public health practice. This transformation holds great promise for the core functions of public health surveillance. The ability to detect, register, confirm, analyze, feedback, communicate, and respond. They can all be enabled, enhanced, and empowered by new opportunities and how public health workers can do their work better, faster, and cheaper. The world is very different today, but so are our capacities to respond. The technologies, methods, and collaborations necessary to achieve a better state exist. In our future state, integrated data across siloed programs becomes actionable public health information that will be available where it's needed, when it's needed, just like we know the global weather. This is a fundamental human right. When placed in context, this adds to our knowledge and provides insight to decision makers. An application on a person's smartphone can have access to the world's information on emerging and re-emerging threats as they happen, sharing the current and future predictive states as well as expert interpretation. This is the future we offer you in Transforming Public Health Surveillance, where integrated surveillance, cross-cutting siloed systems, where new information communication technology, where new analytic approaches for predictive surveillance can transform the public health workspace, along with an informed, educated, and trained public health workforce. We invite you to share in our vision of a future of public health surveillance.